Now notice that the surgeon is standing directly next to the CST. And now the CST will pass accordingly.
Bovie. Okay, so now she is on my right side. So you have to think about, are they on my right, my left, across from me? How am I passing? What hand am I passing to? So you saw how I was normally passing with just my right hand to her right. So now she's next to me. I don't want to bump arms like this. I am right hand dominant, so I had to learn to use my left hand as well. And so now I'm going to pass, and I'm going across, passing that, and then as she is bovieing, I have the suction. I'm not going to pull on the cord. I have the suction, so I am suctioning the bovie plume, the smoke, to keep it out of their vision. I'm not touching the tip of that, and I'm not getting in their line of view, but I'm suctioning the smoke.
You can follow the retractor that the surgeon's using, and you should be out of the view of the surgeon. Okay?
If the assistant is not already doing this, you would be doing this.
And
okay?
if the assistant is not grabbing it, it's okay if you pick up the suction to use it. You don't have to ask. Okay. Hemoclip.
So now I'm going to pass this with this arm. So now look at all this room I have. I'm not doing this and bumping this arm that is holding a retractor or a sharp or whatever else they are holding on to with this arm. I'm not going to do this right here. I'm coming around and I'm creating that space and passing it just there. I'm getting another hemoclip ready. Then I'm taking that. And then if she wanted another one, I'd pass her the other loaded one.
Hemostat. One thing surgeons might do is they will not look at your Mayo to hand instruments back to you. They will simply toss it. Peon.
And so just like I did earlier, she tossed it. I will fix that later. I went for exactly what she asked for next, passed it. Now I can put this up where it goes if I have time. So that way I always know when I have it set up exactly like it was. Because your hands, once you get used to your setup, your hands will find it before your eyes do. So you'll know, oh, this is where I always keep my hemostat. This is where I always keep my peon. Did you ask for a hemostat or a peon?
Peon.
Okay, good. I just noticed my hemostat was there. And so always knowing what you're passing your surgeon. So you don't ever want to pass the incorrect instrument. She asked for a peon. If I had passed the coker that has teeth or Ochsner, it would crush what she was meaning to clamp. So always know what you are passing your surgeon, and you just have to look at the tips and pass it to them. So you don't pass ones that look similar.
Should we do a blade on this side?
Yeah.
Blade.
Okay, so now I'm grabbing my blade with my left hand. There would be no way for me to safely pass this with my right hand with her on my right. So I grabbed it with my left, passing it across. I'm making sure they have it, and I'm up and away. You want me to pick up one?
Yeah, let's do DeBakey.
So DeBakey, so I'm grabbing with my left, placing it like a pencil, just like that. If she were to need something with her left hand, same thing. So
Right angle.
okay, so right angle. So I'm going to grab this and do it like that. So the point is facing down, and I created that space. Instead of doing this, which would be easy, so it's there, I'm grabbing it. If I have it like this, that's wrong. All I have to do is flip, same hand, there you go.
Let's do hemostat and DeBakey pickups.
So I'm gonna put that there, and then sometimes you may have to do this right here, but that's only if you're passing two at the same time, just like that. But generally, if you're passing one at a time, you wanna make sure you're creating that space.
Sen.
So a sen rake, so it has a sharp end and a dull end, so you could kind of look, but sometimes if you don't know, I'm gonna pass it with the sharp end, so that way they see it, and I'm giving that to her just like that. If she needed to flip it, I would know next time, give her the dull end.
And always watch anytime you pass an instrument, moments after you pass it. If the surgeon needs to flip an instrument or adjust it, they will, usually without saying anything. So they'll flip it and then hand it back without a word, and then they'll ask for a sen rake again. And then if you don't flip it to fix what they had to, then they will say something. So always watch the moment after you pass anything.